women, men, and all other genders are susceptible to having breast cancer. So far, you have a breast. My name is Dr. Abida Amosa. I'm a 25-year-old. I recently graduated, but now I currently work in health insurance. Yes, this is true, and I feel like I want to expand on that further. So when you say everyone, we're not just talking about women, men, and all other genders are susceptible to having breast cancer. So far, you have a breast, you are susceptible to having breast cancer. Does not matter what you eat, what your genetics are. It's You can have breast cancer at any point in your life, basically. So rightfully so, breast lumps have been one of the most um, symptoms to look forward to when you have breast cancer. It's what we mostly peddle that um, whenever you are doing your checks, if you see a lump, you should go check it out. But breast cancers are different. There are different subtypes of breast cancers, and it may present in any way or form. You might not have a lump at all. I feel like you should know that you might not have a lump. So you should also look out for things like when you have a nipple discharge that is not milky. That's not to say a milky nipple discharge is not a symptom, but oftentimes the nipple discharge in breast cancer may be bloody or any other type of color. Then you also look around and check the shape of your breast, the color of the skin of your breast. If you are seeing things like changes in the skin and the appearance, you might also want to get that. You should get that checked out. Also, you look at your areola. If there are things like indrawing, maybe there's like puckering of the skin around your areola, you should also get that checked out. While we talk about lumps in the breast, it is also important to get lumps in your armpits checked out. So even if you don't have a lump in your breast, you may have a swelling or a lump in or around your breast, like your armpits. You should also get that checked out. Okay, so according to current medical practices, mammograms are usually suggested from age 40 and above, but suggesting a mammogram really depends on your physician, on your doctor who sees you. If a doctor assesses you and says, okay, this person is at an increased risk of breast cancer, right, they may suggest a mammogram earlier than 40. And for those that are not susceptible to breast cancer, we typically say age 40. So now, how often should you get a mammogram done? Let's say you do start a mammogram screening at 40 years. We usually advise that you should get your screening done every 2 years for people that are like healthy, don't currently have any symptoms. But for those that have an increased risk of having breast cancer, for example, maybe they have a previous family history, maternal family history of someone that has had breast cancer, uh, there's a genetic mutation that people have to breast cancer. If they have things like that, we suggest sometimes even half yearly, like every 6 months or yearly, just so we can pick it early. Okay, so like I said earlier in the beginning of the interview, you have a risk of having breast cancer so far you have a breast. Now, that does not mean everybody that has a breast is going to have breast cancer. What it does mean is that regardless of what you do or don't do, there's a risk there. So we have things called risk factors. That means things that increase your risk of having breast cancer. We usually divide them into two types: modifiable and non-modifiable risk factors. For non-modifiable risk factors, these are, you really can't change it. It's just what it sounds like. Non-modifiable. There's nothing you can do. If you have these things, there is an increased risk of you having breast cancer. For example, older women. When you're already at a certain age, the risk of having breast cancer increases. If you are a black woman, your risk of having breast cancer increases. If you early menarche, I'm going to break. The early menarche means you start your period early. If you start your period early, you are at an increased risk of having breast cancer. If you finish your period late, that's late menopause, you're also at an increased risk of having breast cancer. And this is so because of, basically, just because you're exposed to estrogen for a long period of time. That's the reason why early menarche and late menopause increase your risk. So I'm just going to the modifiable ones. That means the ones that you can't do something about. So Alcohol, if you drink alcohol, you're increasing your risk to having breast cancer. If you smoke, you're increasing your risk to having breast cancer. And this part is actually quite funny because smoking also protects against some forms of cancer in women. Endometrial cancer, for example, that does not mean you should smoke. Like I said, it also increases your risk to all other types of cancers, breast, lung, anything you can count it. So alcohol smoking, obesity, a sedentary lifestyle. Basically, these are things that just increase your risk of having any kind of disease, and they also increase your risk of having breast cancer. So you might want to look into modifying that if you want to reduce your risk of having breast cancer. Okay, I think we've already tackled one misconception. For example, the fact that I don't think men do a lot of introspection. You think because you're not a woman, you can't have breast cancer. You can. A man can have breast cancer. So let's first of all put that one out there. Then secondly, I think I've heard that some people think if you have a bigger breast, you are more susceptible to having breast cancer. The size of your breast has nothing to do with you having breast cancer. The only thing that might say, okay, is a risk factor to having breast cancer is when you have denser breast tissues, and that is not a function of size. So also, I think I've heard, or because of maybe the country we found ourselves, breast cancer is not contagious. You cannot catch breast cancer from touching someone. So whenever someone has breast cancer, that is not the time to start moving away from them. I think there's been a lot of awareness in the couple of last years that we've had about breast cancer specifically, and I think as a country we're getting there, right? But even at that, we still have a lot of people that would prefer faith based or traditional based medicine for breast cancer. And I would just like to put it out there, it's not something you can pray away. You can't pray alongside scientific, accurate based treatments, but you cannot pray a breast cancer away without doing anything. So if you do have symptoms of breast cancer, my only advice for you would be to see a physician. I try to speak generally because, like I said, I'm not a surgeon, so I do not curate treatment plans for people with breast cancer. That falls to the general surgeons. But just generally, treatment plans are created for patients based on individuality. Whatever works for one person might not work for the other person. So, what are some of these things that we consider when we want to create a treatment plan? I mentioned earlier that we have different subtypes of breast cancer. Now, we usually, and that is the most common accepted method, you base your treatment plan based on the hormonal subtype of the cancer. There are some cancers that are hormone receptor positive, the treatment is different. The way you treat someone that has a hormone receptor positive breast cancer is not the same way you treat someone that has a hormone receptor negative breast cancer. And then we also have something called a triple negative breast cancer, which is the most common type of breast cancer that is seen in living in Nigeria or black women in general. The treatments for this majorly is surgery, chemotherapy, and radiotherapy. All three, because triple negative breast cancers are they are very aggressive, very malignant. Like metastatic, they spread everywhere. So you have to be aggressive also in the treatment. You have to go for surgery, chemotherapy, and radiotherapy. You also want to look at the age of your patient. The way you will treat someone that is presented at, let's say, 30 years or 40 years is very quite different from when you treat from 18 years. You do not do things like just rushing. So human is already old, right? So you want to base the treatment plans based on the age. And also in Nigeria, you also want to look at financial capability of the patient. We as physicians always put that into consideration. There are drugs that are cheap, there are drugs that are expensive. There's no way those that are cheap and not expensive. Just make us for your patients. So I think the access from that the choice of treatment will always depend on the physician and his assessment of the patient and the patient themselves. I think my First thing to say to patients themselves, we come to family later. To patients themselves is that it's not a death sentence, right? If you get a diagnosis of breast cancer, the world is so much advanced now that there are lots of treatment options available. And I would just like you to know that it's a marathon and not a sprint. You have to be patient. You have to be patient, go to your doctors, find out more information. Anything you are uncertain about, speak to your doctors about it. And if you have any faith, you hold on to it. Try to believe in time. And also that. So, like I said, it's a marathon, not a sprint. Just be reassured. Know that because you're gotten diagnosis of breast cancer, it doesn't mean that you are going to die. Now, for families of those that are suffering with breast cancer or have breast cancer, I would just want to be there for them, right? They are the ones going through this terrible disease. Be there for them. Do not center yourselves in their problem. They have a lost idea of it. And when someone tells you things like you have cancer, it's just a devastating news. And you should try to be there for your family as much as possible. In any way that they may need help, doesn't have to be financial. To just be like a listening ear. It's very paramount that survivors or people that are currently have breast cancer will not also have to suffer psychological pressure while going through it. The only real thing might not readily, they might not readily available in Nigeria. That's what of course. But they're always not. So after treatment, whoever is just like another regular person, except the recurrence or their risk of getting breast cancer increases. If you had breast cancer before, your risk of having it again in hand. So the only thing I'm going to say is what you should do after the giving birth is to follow up on their follow up on your screening. You have to take it even more religiously this time. Then you also have to prepare yourself mentally. And this may happen again, but likely it may not happen again. So if you need to see anyone, a therapist, it is recommended that you sit down, talk to your family, talk to your physician, try to distinguish from other risk factors. If you have one risk factor, then I think that it's okay with all of us. Yeah, there's someone that really has breast cancer. Not for you. I think that's my only advice to people that have survived breast cancer. Second is wonderful. To be honest, when I first of all came across it, I just had to make sure that I was part of this. Because even though, like I said, the awareness has been ongoing for a while, there's nothing like creating a space for people that are going through this situation, knowing that they have a community, a family, it's much more better than anything that has been happening. And diseases, like I said, can be very isolating. So when you're suffering from something, it's always better to know that there are people out there that so I think this is a very, very special thing. I am honored, really honored to be a part of this. And for the government, I'm sorry, I'm a skeptic, but the only thing I would say is that the government should just try to do better for everybody in terms because aside from the fact that the healthcare itself is very poor, the general healthcare is very poor, not the complaining. So if we do things like increasing funding for healthcare, increasing just overall attention to healthcare, I think that's going to help a lot. And then also the government can do things like this, like raising awareness